The South London Stroke Register is a long-running population-based database, including information on the first stroke of patients in South London, who are then followed up at different points over the next few years. It's a powerful and important resource for research into stroke. The Patient and Family Group is an ever-evolving group consisting of members who have contributed to the group for a number of years and some only for a couple of months. This group works with researchers to discuss and develop research that aims to have a real impact in the lives, experiences and health of stroke survivors and their families. Any stroke survivor or family member who is part of the South London Stroke Register is welcome to join our Patient and Family Group.
I think it's fantastic. We are sharing with each other. We are not alone. Meeting every 2 months was fantastic for each one of us.
Open communication between stroke survivors and researchers is hugely important.
To actually ask the question and to ask questions. If you can put the patient at the centre of the research, then you're more likely to get valuable things out of it, because they have a lot to offer, but they don't know how to give it, and they don't know what will be useful and what won't. So if you can work together on that.
To build up the trust when the researcher is able to communicate, like in a way, they will not gonna be scared.
Recently, we've been working with members to make the group more inclusive of the diverse ways a stroke can affect patients and their families. Stroke might affect someone's ability to do certain things for themselves, their mobility, their thinking. They might experience fatigue. And common in 2/3 of stroke survivors is a difficulty with communication after stroke.
2009, I have aphasia. I had a stroke. It is when I can't remember everything. Every day, a stroke, they have many challenge.
We are unique in a way, the stroke we had. Many of us should have gone. And it takes time to talk, to read and to write.
I'm slowed right down. I feel sometimes like I need more time to think and more time to work things out. I've been told that I need to stop and reflect, maybe to summarize the question in my own head if I'm going to get a good answer out.
I have memory problems, and the speech difficulties is putting across what I want to say, and I'm sure sometimes they will not understand what I'm talking about because it's different from what. And another thing is, sometimes when they explain things, I interpret it differently. And I think for all stroke survivors, that's a common thing.
We are working with current members to make it easier for stroke survivors with communication difficulties to participate in our group, designing ways we can give more time to stroke survivors to collect their thoughts and express them, to help researchers ask meaningful questions, and make the discussions about research accessible to all stroke survivors. The group highlighted many things, from providing materials in different formats, including a brief 5-minute presentation or video a week before the patient and family group meet, through to having ways for stroke survivors to comment after the meeting in writing or via speech when points become clear to them. We're working hard to make the patient and family group an open and inclusive space for all stroke survivors. We want to ensure that all stroke survivors' voices can be heard and can contribute to the research that we do.